Greetings, Porter County. Welcome to yet another edition of the PoCo Wellness Hour, right here on WVLP 103.1 FM, your voice for local community radio and your show for community connection, health, and overall well-being. I'm Demetrius Lewis, Communications Manager for the Porter County Health Department. Here on the PoCo Wellness Hour, we like to take this opportunity to shine a spotlight on the incredible health initiatives that are shaping our community and the powerful partnerships that make it all possible. From local organizations working to improve public health to the innovative programs led by the Porter County Health Department, this show is your guide to stay informed, inspired, and engaged on your wellness journey. So sit back, relax, and let's dive into today's conversation about building a healthier community together. Now, today, as we always do on the PoCo Wellness Hour, we have a very special guest. In this case, we have a very special guest from the West, and they know a thing or two about the good old public health and the health department. Ladies and gentlemen, let me introduce you to Dr. Janet Seabrook, the health officer for the Gary Health Department. Doctor, how's it going today?
Good morning. Going pretty well.
Awesome.
All right.
We appreciate your time today, ma'am. So, for those who may not be familiar with you, let's dive into a little bit about your background. Can you share a little bit about your childhood? You know, what it was like for you growing up, maybe where you did grow up at. Where you from, ma'am?
So I was born in Charleston, South Carolina. Yes. Where my grandparents both are from, and my parents moved to Gary when I was very young. I am a graduate of Gary Roosevelt High School.
Okay.
I attended Tuskegee University in Tuskegee, Alabama, where I obtained my BS degree in biology. And from there, I went to Meharry Medical College for my medical training. I did my residency at Methodist Hospital in Gary, Indiana. I became a family medicine physician. I worked for a few years in Chicago and decided that drive was not for me. And I worked with the city and the state to start a state-funded health center for Gary. And then we eventually placed an application to become a fairly qualified health center. I've always, in my role, first as CEO and founder of the health center, I've always worked very closely with the city and the public health department. And so I went back to school, decided to go to Purdue and locally at Purdue and get my MBA. And then now, currently, I'm enrolled in IU.
Oh, still school.
Still doing school to obtain my degree in Master's in Public Health. I've always had an interest in doing public health. So growing up in Gary, I received a lot of exposure to professional people. My mom and dad are golfers, so we spent a lot of time on the golf course. I got to meet a lot of doctors. My first interaction with a doctor that made a home visit when my mom was very sick. And I think I was 2 or 3 years old at the time, and I never forgot that. And his family, actually, it was Dr. Ross, his family, and he was over our residency training program. His family actually asked me to speak at his funeral. And as I was putting the words together, I remembered that visit and how he took care of my mom and got her back to health. So just always had that interest. In kindergarten, we had to stand up on the first day of class and say what we wanted to be. And right before, maybe a week or so before school started, I had to go and have my school physical. And so I got to see the doctor, and I was so fascinated with the stethoscope. And I was like, I want to be the one that carries the stethoscope. So when I stood up in class and said that, the boys just cackled. They had a good laugh about that because, only, ladies, girls are nurses and boys are doctors. And, that was the tradition back then. And so my kindergarten teacher got up and she came over to me and she held my hands and she looked in my eyes and she said, "You can be anything you want to be." And I've always taken all of those words of her words of encouragement, what I saw Dr. Ross do for my mother, and then the leadership of that pediatrician that took care of me to do my back to school physical. All of those things had an impact on me when I was very young. So in kindergarten, I decided I wanted to be a doctor, and I've never swayed from that path.
That is so cool. And of course, we've come a long way breaking down those barriers,
yes,
those stereotypes and whatnot. So your career path is certainly inspiring to those who, would like to take a path in medicine and whatnot. That's very inspiring. So you were influenced, like I said, since you were kindergarten. You knew you were going to kind of follow this path since you were a little girl.
I did, and there were no other doctors in my family. I pretty much set the precedent and tone. I have 4 sisters. Couple of them are nurses, and so we do have, a lot of healthcare people now in the family, and people who have selected and chosen professional paths to go into.
Gotcha. What was it about public health, specializing in public health, that really interested you?
I think that because I was a national health scholar, you have to, if they help you pay medical school tuition. And so you have to serve in an underserved area. And the closest one was in Chicago. So when I finished the residency program, I was assigned to a fairly qualified health center in Chicago. And I saw the need. But I think what really got me the most was there were patients from Gary that were actually traveling to these health centers in Chicago because Gary did not have one.
Gotcha.
And so that's really what made me want to kind of take a look and see what could Gary do to have the same type of programs that they had in Chicago for the underserved. And that's what, forward like 25, 27 years now?
This is just a blur at this point.
It is.
So can we talk a little bit about the path that led you to becoming a health officer in Gary? It sounds like you kind of started a little bit with the last answer.
So when I was a second-year resident, the current mayor at that time of the city of Gary asked me to sit on the Board of Health. So I got to see firsthand as a board member and a resident doctor the need that there was in the city of Gary. So I was able to help write that first grant to ask for those fundings when the state opened up funding for community health centers in Northwest Indiana. And so I think that was my first inclination. So finished up my 3rd year, graduated, got assigned to go to the FQHC in Chicago, and realized I'm here working on the need for residents in Chicago when I've sat at the table, and I'm still sitting at the table knowing that there is a greater need in Gary because we don't have a community health center.
Understood. I think an interesting connection to this, even though you were born in the South, you're pretty much a Hoosier. Like you said, you grew up in Gary, so you're a hometown kid, so to speak. How does it feel being able to come back to a place where you grew up to help? It's rewarding, it's humbling, it's all of those things mixed up because there is just so much need. And, I'm just a small piece in a big puzzle as, the revitalization and the resurgence and the rebuilding of Gary, takes place. And you have to have well residents, you have to have healthy residents Absolutely.
that can, go to work, utilize the public transportation, pay their bills, keep their homes and apartments up to code. So you need a healthy population is what I'm trying to say.
Understood.
So I'm hoping that my role as health commissioner and my leadership as health commissioner will help give the education and information that is needed. Now, I'm not the boots on the ground. I am the spokesperson. I am the leader, but there are people. The health department employs about 30 people.
Right.
So there are health inspectors that go out and inspect restaurants, gas stations, apartment complexes, the whole 9 yards. We have vital records where people can come and order now online their birth or death certificate if it's needed. And we have, of course, HIV and STD testing and treatment and surveillance. So there are a lot of things going on at the health department. We have a public health nurse there that actually helps with TB surveillance. Also, we do, there are still people that have births at home, so those newborns have to be assessed and evaluated. So the moms and dads bring them to the health department, so I get to do the first examination of the baby after it's born, if it was a home birth. So there are a lot of things going on at the health department. One of the newest things that we did was we implemented a division of behavioral health. Because as you know, in this country, mental health is a crisis now in the country. So we, the Gary Health Department, wanted to figure out what can we do to help to address this need. So by creating this division of behavioral health and hiring a behavioral health coordinator, taking some funding that we had set aside for mobile health crisis intervention, we created a mobile health intervention team where we created a network of community partners by giving them funding. About 11 agencies receive funding for the next year and a half, where they will work with the de-escalation, the post-de-escalation. So say police, fire, or the actual mobile crisis intervention team has done the de-escalation. Now let's look at what actually caused the escalation and how can we help to stabilize that person so they don't fall into that same cycle again. So that is why the network is created. We have a group that works with autistic children and doing therapy with them. We have another group who specializes in people with substance use disorder. And so we have a plethora. We have a church that is receiving funding as well. And they have a cafe, so to speak, for people to come in who've had behavioral health issues and drug utilization. And so they're coming in and creating these networks of how can we get you to the various resources in the community that can help get you back on your feet and get you engaged and involved in the community.
You guys have a lot of moving parts going on there.
We do, and we have a great staff that's there that's pretty much handling the day-to-day operations. So I can come and speak to people like you on shows like this.
That's what it's all about, man. It's the teamwork that makes the dream work,
yes,
right?
It is.
You said earlier, you know, a community without health is a community that is... Health is the number one aspect that, you know, that you really need. You can't do anything without your health. Your health is your number one wealth. So that was a really good point that you made, ma'am. Like I said earlier, you have a really impressive resume, ma'am. I'm sure there are a lot of people listening right now who could be inspired by your career path. So let's jump to our next segment and talk a little bit about your professional path and maybe some advice to others.
Sure.
On your way to becoming the health officer, if any, can you talk about, you know, maybe some of the challenges you faced or anything that you had to overcome, if anything?
I think as a African American female, you're going to have some challenges. I would like to say that there weren't many. There were a few. And you have to kind of figure your way through. You have to make sure that people see you and hear you. I do have a voice, I do have an opinion, and I do have a mind. But I also respect people in positions of authority and people who are my seniors in regards to colleagues and things like that that went to medical school. Just not a lot, but there were some, but I managed to work my way through because I am someone who has a strong faith and a belief. And so I do a lot of prayer and just a lot of mindful thinking and reflection.
Gotcha. And how long have you been the health officer in Gary now?
February 1st, 2024.
Okay.
Yeah.
Gotcha.
So this is going into my second year.
It's working so far, right?
So far, the mayor hasn't called me to the office to say otherwise.
No. Mayor Middleton, he's a good guy.
Yes, he is.
So, what advice would you give to young people or even, you know, mid-career professionals who want to pursue a career in medicine or public health? Like I said, a similar path to what you're on.
So I would tell the person, pick something that you enjoy, okay? If you enjoy spending time with small children, then maybe it's pediatrics. And maybe, and I like to tell people that everyone can't be a doctor and everyone's not meant to be a doctor. And there are other professions in the health field, and that's why we like to bring high school students into the office so they can see the various fields like dental assistant, registration staff, dental hygienist, medical assistant, nurse practitioner, registered nurse. Our IT person gets the most hits when he goes out to have conversations at the high schools and things like that. He always gets the most questions and the most callbacks and feedback. Can he come back? Can he come back? So, and people don't realize we have electronic medical records. We have all kind of digital information that is, going both ways. And same in public health and at the health department. A lot of information, a lot of digital information. So there are so many things that you can do. There are health inspectors. They can go out into restaurants and stores to make sure that they are in compliance with the health standards. So there are a myriad of opportunities. The person who dispenses the birth and death certificates, that person has to be trained, and then all the state statutes and regulations in regards to releasing that information to the public. So there are many things that are careers in public health.
Absolutely. When you were going through school, when you were coming up early in your career, were you aware of what a health officer or a health commissioner does for public health?
Yes. And the only reason why is because I've always paid attention to who the Surgeon General was. And I think the first one that I remember is C. Everett Koop. And talking about the warning on the back of the cigarettes.
Yes.
Yeah, from back in the day. And so that was my first interest. And then when we started to see representation of Dr. Satcher was the U.S. Surgeon General for a number of years under, I want to say, President Bill Clinton. Okay. And so Dr. Satcher was the president of Meharry Medical College when I was there. So we were his last graduating class before he went to the CDC for a number of years, and then he got the role. He was appointed to the role of Surgeon General. And so I like to say that, I also, Dr. Jerome Adams from Indiana, he served in a role as Surgeon General as well. And so I know both of them. And so I think that I look to, I've just always been interested in public health. But like I said, that first catch-all was Dr. C. Everett Koop. Whenever he came, his face popped up on the television for those responses, I would always, turn away from what I was doing just to watch him.
Absolutely. That is awesome. That is awesome. What do you find most rewarding about serving as a health officer? It sounds like you really praise the team that's around you. I
think that getting out in the community when we have events, we recently had a prenatal event, had a huge turnout at Marquette, where you had moms and dads and smaller children. A lot of pregnant moms were there, a lot of education, a lot of vendors. People really came out to support the prenatal community, and it was just so enjoyable seeing so many families coming together, but then the people from the community actually came with giveaways and items and things that they wanted to share with those families. And so I think when we have events like that and we can hear people saying thank you for thinking of us and thank you for this information, I think that's one of the most rewarding parts.
I would say that's probably my favorite aspect of the job that I do too, getting the chance to be on the outreach team, doing those outreach initiatives, going to other events or hosting our own events, setting up those booths, meeting people from the public, meeting people from other organizations. I like to network, and I just like to meet new people and whatnot. So I totally understand where you're coming from, Doctor. You touched on a little bit something that we're going to jump into for our next segment, Safe Sleep Awareness Month, which is coming up here in October, where we are right now. This is such an important topic, especially for families with newborns and those that are expecting babies, babies on the way. So what does safe sleep mean, and why is it such an important public health concern?
I think that people need to understand and be educated that babies need to sleep by themselves. And I don't think we say that enough. Co-sleeping is not good, even though it feels good. When they're down for their nap or sleeping throughout the night, they really shouldn't have any toys in the crib with them, and there shouldn't be all of those cutesy frilly things that we like to, wrap around the crib and things like that. And there are a lot of instructions out there. You can go to the Safe Sleep website for more information about how to make sure that your child is sleeping safe. And, there are some people, they'll say, I don't have a crib. Okay, there are places that will give away pack and plays.
Absolutely.
And so those are safer than actually, sleeping in the bed with you. And so I think, even though it feels good, I know I'm a mom. As tempting as it may be, it's not safe. So please go to the Safe Sleep website for more information about how to make sure that your child is sleeping safe.
As somebody who's not a medical professional, I'm just a communications guy. I'm just a social media manager. It is interesting to see how procedures and policies have evolved over the years. I remember when I was a little boy, I remember my crib, I had a stuffed animals, blankets, my little Power Rangers and all that kind of stuff. And kind of like you just said now, that stuff is a no-no these days.
It is. And as we live, we learn. Mm-hmm. And so lessons learned, and unfortunately, there had to be some deaths for us to realize that, no, you shouldn't put this stuffed animal where the eyes can pull out and the child can actually swallow and choke it. Right. We shouldn't put a mattress that doesn't fit snugly against the crib walls. We should not do that. We shouldn't put a crib next to a window that could potentially, a child could stand up and push the screen out and fall out. So there are a lot of things that we did. People put the crib by the window so you can get some fresh air. Yes. Now, we don't do that anymore. So we have to think about, as we evolve and as we learn and gain more knowledge, then we need to take those things and put them into action. And safe sleep is a part of those things that have come through information, education, unfortunately some childhood deaths too.
Unfortunately. But as you said, as time goes on, we evolve and we learn. What are some of the bigger risk factors that you're seeing in Lake County when it comes to infant sleep-related deaths?
And so in Lake County, our biggest issue right now is infant mortality and reducing infant mortality and those deaths that occur in children before the age of 1. And so we're making a concerted effort. We've partnered with an organization that actually works to get moms into prenatal care and early in their pregnancy instead of in second or third trimester, mm-hmm. where some things could have harmed the fetus before the mom is even aware. And so in doing those partnerships, those are ways that, even though the health department itself is not providing prenatal care, we're empowering organizations that do provide those services to make sure that they're able to have the resources that they need to get those moms in early so they can manage those pregnancies and give them the information that they need during those 9 months.
Absolutely. It's all about the teamwork and the partnership.
Yes, it is.
Not just for Porter County, but for all counties here in Indiana.
Yes.
I just want to talk a little bit about the numbers that we've seen in Porter County so far in 2005. So far, we have had a total of 5 deaths in 2025. We've had 3 fetal deaths and 2 infant deaths. The 2 infant deaths, the thing that they have in common are the unsafe sleep. They were on couches, sectionals to be more specific. So, the couches, it's a factor, but not necessarily the cause. So kind of like you mentioned earlier, couches, making sure that the mattress within the crib is a nice snug fit so that the baby can't,
be wedged.
That's what I'm looking for. Thank you, doctor. Be wedged in there, because I think that's kind of what we're seeing, at least here in Porter County, with those situations. But it is important to make sure that they have proper sleeping areas, like you said. Maybe alone, not by a window. It's important to follow these steps because, kind of like you said, as time has gone on, we've seen a lot of different situations. We've seen a lot of unfortunate situations where families did have to suffer in order for us to kind of learn this information, unfortunately.
Yes, and let's not forget on their back.
On their back.
On their back.
That's why you're here. The ABCs, right?
Right.
Yes.
Well, just remember being on their back. And I think that some incidents may happen as the child is, laid down on a soft surface like a couch. And if they're, not quite on their back, they don't have the ability to roll themselves over. So they might be stuck in between those cushions of the couch and not really, they can be smothered.
Understood.
Is what the final outcome potentially could be.
At that stage, they're just not strong enough, like you said, to lift themselves and move themselves into a more comfortable position. If a family does need resources or guidance, where can they go in Gary?
So you can go to the City of Gary's website, gary.gov, and in that you'll see a link to the Gary Health Department. And when you click on that link, you'll see all of the services that the Gary Health Department provides. You'll also see the phone number and the address.
Understood. And now we've touched on this a little bit. We're going to go to our next segment, community collaboration and outreach. Health departments don't do the work that we do alone. Of course, we partner with schools, other organizations, local businesses. Can we talk a little bit about what Gary's doing, partnering with different organizations? Maybe you partner with different hospitals or some other organizations that you'd like to give a little shout out to?
Sure. So we partner very closely with Methodist Hospital Northlake Campus. We actually have the Vaccines for Children program, and we have the state's permission that when we have power outages, that Methodist can store our vaccines. So we make sure that we're keeping the vaccines safe, they don't spoil, and when the power comes back on, then we are able to utilize those vaccines. So that is a very strong partnership. Also, Methodist does food banks. And we partner with them. They have fresh fruits and vegetables certain times throughout the summer, so we make sure that information gets to the clients that are coming to the health department. We partner with the Gary schools and the charter schools. We have school liaisons that go to the schools to find out what the needs are in that school's community and bring that information back to the health department, so then we can share the resources that we know that's available in the city of Gary for those students at those various schools.
Gotcha. So let's talk a little bit about why it is important for the public to see health departments as partners and not just regulators. In my job as a communications manager, promotions, advertising, one of the main things that I do in my job is to tell the story of the different departments that maybe other people don't know about. I feel like our nursing division are the rock stars of the organization. Everyone knows about the vaccines and whatnot. People aren't necessarily familiar with the foods division until the favorite restaurant gets shut down.
Correct.
No one is really familiar with environmental unless you live in a country type rural area and you have to deal with septic type issues. A lot of people don't know about these different entities that we have, and a lot of them can kind of see us more as just regulators as opposed to other parts of the community. So can you talk a little bit about that, with your experience in Gary and why it's important for the people to see us as part of the public and not just regulators?
Well, I think you're doing something here that's helping to dispel a lot of that by getting the information out about the different divisions within your health department, the same as we do in Gary. I am on several radio stations in the Northwest Indiana area, and I try to bring information not only about what Community Health Net, my organization, does, but what the Gary Health Department resources the Gary Health Department has for the residents of Gary. So I think it's important to just continually, repeat be on repeat about some of the services, because people do get fixated on the vital records and the, STD and HIV testing and the nursing, public health nursing, and kind of, they don't realize that this is all a part of public health. You don't, of course, want someone with an infectious disease being in the community and not being treated. Mm-hmm. Likewise, you don't want a restaurant or a grocery store serving unsafe food or keeping food in unsafe practices and unsafe environments. And so we just have to keep putting it out there, and sometimes we work in collaboration and partnership with the police and fire department when we're going into residential to do those inspections to make sure, as far as on the public health safety, they're meeting those regulations. But then, police and fire have to also make sure that things are, that there isn't somebody there who shouldn't be in that facility. And then the fire department needs to inspect and make sure that they're meeting compliance with the basic fire safety needs of a facility. So there are a lot of things that tie together that people don't understand how the public health department works to serve the entire community.
And I think it's important for people to understand that even though we're working, we also live, we play, we raise our families in these same communities. So every rule that is created, every code that is enforced, it is for the betterment of the public. It is for the betterment of our community.
Correct.
So I think it's important for people to understand that we're not just regulators. We live, work, and play in this community, and we want this to be a safe and thriving environment as possible.
No, I definitely agree. I concur.
Absolutely, doctor. Let's move on to our next segment. Flu season. It's pretty much right upon us. You can probably hear it in my voice a little bit. I'm not sick, but it is my allergies. So if we could talk a little bit about, as we head into the fall, flu season coming right around the corner, why is it important for people to keep up on those flu shots every season, every year?
So, we have a lot of people in the community that are elderly with chronic diseases, immunocompromised, even young children who may have some form of cancer, adult that may be suffering with cancer. Mm-hmm. And those most vulnerable, we want to make sure that they are vaccinated with the flu. I think it's important to have those conversations with your healthcare provider. I share this with people all the time. But what people don't realize is that sometimes kids will bring the illness into the home from school, but they won't be sick. Mm-hmm. And so there were several incidents last year and year before last with teachers, being out, and so needed to call a lot of substitutes. And it was because the kids were sick, but they weren't sick. They were okay to come to school, but they were bringing that virus into the school, and it was impacting the teachers. Same with the firefighters and the police officers. And so I think it's important that especially those who are going to be out in the public, mm-hmm. make sure that they are vaccinated. Our police officers, our firefighters, we're doing huge flu clinics right now for our police and fire department to make sure that they're protected, because they're out there in the community every day exposed to, the flu and other things that are out there this season.
Gotcha. Is that clinic going on right now? Is that something you want to talk a little bit about?
I think we held it already. We held it on the 30th at one of the fire stations, if I'm not mistaken.
Okay, mm-hmm. Absolutely. It's the time of year for it.
Yes, it is.
So what myths or common misconceptions about the flu or the flu shot would you like to clear up?
So one of the big ones is, every time they give that to me, I get the flu. What you may have is a milder version, but it's helping to build up your immune system, so when that big nasty flu comes out, you won't be as impacted. And I think people need to understand that potentially is a side effect, that you might get a milder version. But imagine if you hadn't had the flu shot itself. It could be something that could put you in the hospital. And people don't realize that every year about 63,000 people in the United States, adults, die from influenza. And about 325 children under the age of 2. And that's every year in this country. The lowest numbers, for whatever reason, was when we were in the lockdown in the pandemic. Mm-hmm. And our flu numbers were pretty nominal for the most part. And I don't believe we had any childhood deaths. If we did, it were less than 10. Versus in a normal flu season year, like I said, 325 children under the age of 2 pass away from flu, and 63,000 adults.
It's a serious issue.
It is.
It is something that you need to take care of every season, every year, ladies and gentlemen. When it comes to residents in Gary or even Lake County, where can they go to get your flu shots? I'm sure they can go to the Gary Health Department, correct?
They can go to the Gary Health Department. They can also go to, I'm sure, the Lake County Health Department. Community Health Net also has the flu vaccine if people are interested. And we have 9 locations throughout Northwest Indiana, so they're able to come to Community Health Net as well. But definitely the Gary Health Department has the flu vaccine.
Lots of places, lots of opportunities for you all to take advantage of that, to get that taken care of. What other steps can people take to stay healthy during flu season?
I think it's important to stay active. You know, if you're someone that works out, you want to continue your workout. Make sure that you're being safe. If you go outside of the house to work out, maybe at the gym or something like that, making sure that the equipment is wiped down with each use. Stay hydrated. If you're someone that takes vitamins, maintain your vitamin regimen. Eat healthy, and that helps to, you know, pretty much your vegetables, and you want to stay away as much as you can from fried foods, a lot of starchy foods. I know all of those good things, but the ways to maintain your health during the flu season. But pretty much, you know, staying hydrated, keeping your exercise routine up. If you are going to be in public spaces, make sure that you're taking care when you're, you know, touching things like doorknobs and shared equipment and shared spaces.
Wash those hands and carry hand sanitizer.
There you go.
You know, we are getting towards the end of our segment here, our program here, the PoCo Wellness Hour on WVLP 103.1 FM. Doctor, as we wrap up, I'd love for you to share some final thoughts. What motivates you every day to keep serving in this role for Gary?
I think when I think back to when I first became a resident doctor at Methodist Hospital and had the ability to do deliveries on my own after I was trained, and just watching the families delight and their faces light up when a new life was brought into the world. Mm-hmm. And then I think something else that helps me when I decide to come out of my office is to especially on those days when the paperwork is just too much and the phone is ringing, emails are just off the charts. And I take a deep breath and I'll step outside my office, go into one of the waiting rooms and run into a patient that I used to take care of, you know, or I deliver, you know, their blah, 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 their child, whatever it was. And I'm just like blown away. And that brings me back to center and to reality. And that helps me out a lot.
Puts it all in perspective.
It does. It does.
What is one thing you want our listeners to take away about the work that is being done at the Gary Health Department?
That it's work that is, we are very mindful of the needs of our community. Mm-hmm. And we listen to our community. We have, there's a 311 line that residents can, they can use that app and put things in there. They email, they call, and we listen to their concerns and we try to address them as best as possible. So you may not necessarily get everything that you want, but we're going to do the best that we can to make sure that, you know, the public is safe and there's quality, you know, care being delivered from the public health department in Gary.
Absolutely. How can people stay connected to what is going on at the Gary Health Department and keep up with important health information? You want to plug your website, maybe some social media sites that you guys run? So
you can go, like I said, to the city's website, and then you can click on Gary Health Department. You'll find information there. You can also go to the City of Gary's Facebook page and other social media and look for the Gary Health Department.
It's a lot of good stuff on there. I've had the pleasure of taking a look on there. You guys have a lot of things going on in Gary, not just at the health department, but the city in general. You guys are definitely moving in the right direction. I'm going to be honest, Doctor. I don't remember if I sent you these next questions. I probably didn't because I wanted to get your general reaction to some of these. There's some fun questions. So as we close out this segment, I've got about 4 or 5 other questions here that have nothing to do with health department, nothing to do with medical stuff. Just an opportunity to get to learn about you a little more.
Okay.
Are you ready?
I'm ready.
All right, Doctor. Question number 1. If you had to pick a spirit animal that best represents you, what would that animal be and why?
I like dogs. I like puppies. Mm-hmm. And I had a Pekingese for a number of years, 19 actually.
A Great Pekingese?
Pekingese, the tiny one.
I got you.
Yeah.
Got you.
His name was Spice. I loved him to death. He helped me get through medical school and had 10 years with my children. Mm-hmm. And then at 19, we had to put him down. But I would say that my spirit animal is a dog. and definitely a Pekingese because he was so chill.
A little lap dog.
Yes. Except he didn't like to be in your lap.
No.
Really, very independent.
Okay. And 19 years, that's a long time.
I took care of, I like to think I took care of him very well.
When I was a little boy, I was born in St. Louis, and we moved to Fort Wayne when I was in second grade. But before that, we had a dog. It was a German Shepherd, all black German Shepherd. He lived to be about 22 years old, and he was an outdoor dog. We still took care of him, but he didn't like being inside. But there's something about those dogs, you know. I totally get you. I guess my spirit animal, I want to say a lion, because I like to sleep, and I'm a little lazy sometimes. I would say maybe a killer whale, an orca, like Free Willy. They are called the wolves of the sea. Are you familiar? Yeah.
But I'm just thinking if I had a second choice, it would probably be a horse.
A horse?
Yeah, I love horses.
Okay. We're wild and free.
Yes. Yes.
I get you, Doctor. I get you. When you were a little girl coming up, what was your favorite Disney movie or cartoon growing up?
Well, I grew up watching Ray Rayner, and so I used to like Wile E. Coyote because it would make my father have big belly laughs, and anybody or anything to get him to have a big belly laugh. I mean, we knew the anvil was coming. We knew that the going over the cliff was coming, and he would just crack up. And I think the other ones would be, of course, Mickey and Minnie, Donald Duck, and Tom and Jerry.
Tom and Jerry. That's a classic right there.
Yeah.
Okay, gotcha. I have a lot of Disney movies. I'm not even going to get into it. I could be here all day. So when you do get some free time, when you're away from the constant ringing phone and the large piles of paperwork, what do you do to relax or recharge yourself?
So I love to garden. And in the fall, like now, I need to start. I'm already planning on cleaning up, cleaning out the beds, and trying to prepare, for next season, getting everything kind of winterized and ready for the snow. So I have some plants that I want to protect, and some will come in the house. Others will get covered up with burlap and blankets, and to make sure that their roots stay nice and cozy during the winter. I hate to see my plants suffer, so I'm going to be doing that hopefully sometime this weekend. And it's supposed to be nice this weekend. The other things that I love murder mysteries, either reading them or listening to them. Agatha Christie, right off the top of my head. I love like spy mysteries, spy things too, like Tom Clancy novels. I like the Tom Clancy series, and Stephen King as well. So, those are some of the things. And then I crochet. And I think that those are the things that kind of keep my mind, relaxed and help me relax.
Gotcha. When it comes to Stephen King, you mentioned the book. What's your favorite Stephen King movie, if you have one?
The Shining.
The Shining. Okay. Here's Johnny.
Yeah.
Gotcha. I think mine's Pet Sematary.
Okay.
That one really messed me up as a little boy. I can finally watch it now, but it was definitely something little kids shouldn't watch. If you could have dinner with any historical figure or public health leader, past or present, who would it be? Whose mind would you like to pick?
I think Dr. Satcher. Like I said, he was the president of my medical school when I was there, and then he became the CDC director, and then from there became the U.S. Surgeon General. So I think I would love to have a nice sit down with him.
There you go.
Yeah.
Awesome. All right. So this last round right here, we got a couple of quick fire questions. Coffee or tea?
I'm a coffee person.
Gotcha. Are you an early bird or a night owl? I think I know the answer to this, but...
I like to stay up, but I've been trying to make myself go to bed later because my husband gets up at 4 a.m. and I wake up with him. So I've started to make myself go to bed earlier. He goes to bed at 8 p.m. I cannot do that. So I started, making myself go to bed at 10. Okay. Because we wake up at 4. Yeah. And I don't go back to sleep.
That's what I was thinking. I was thinking you were more of an early riser with the kind of job that you have, but you want to go to bed early, but nothing wrong going to bed at 8 o'clock. Nothing wrong with that.
That was my bedtime when I was little.
Doctor, don't judge people. Okay, final question here, Doctor. Would you rather take part in a beach vacation, a nice little getaway, or a mountain getaway? Something like Lake Tahoe or something?
I'm more of a beach person. Of course, that's where mainly when we go places is because of the beach. But that's kind of interesting to go, because I've never done like a mountain vacation, and I've never been to Lake Tahoe, so that might be something that I would be interested in doing. But right now it's beaches.
I hear you.
Because that's what the kids want to do.
I'm not a snow guy, and I don't really need to see any mountains. I want to see the water. I want to put my toes in the sand.
Yes.
Dr. Seabrook, thank you so much for your time today, man. We really appreciate your expertise and the time that you're taking out to come on here on the PoCo Wellness Hour to make your way out here to good old Valparaiso here in Porter County. Doctor, is there anything else you'd like to say before we sign off, ma'am?
I just want to say thank you so much for the invitation. It was so nice being able to spend this time with you. Absolutely.
We're going to have you back, ma'am, if you don't mind. Absolutely. Let's talk about a couple of things that are going on at the Porter County Health Department. Want to learn how to save a life? Well, join us for hands-only CPR class in recognition of World Restart a Heart Day. We're hosting 2 sessions that are happening on Thursday, October 16th at the Administrative Building in downtown Valparaiso, 155 Indiana Ave. We have 2 sessions for this. One is starting at 10 a.m. and the other will start at 2 p.m. Both of these classes are 90 minutes long. Space is limited, so please reserve your spot today. You can send an email to Tara Keenan at terrakeenan@portercountyIN.gov to sign up, or you can just give us a call at 219-465-3525. Don't miss this chance to learn how to save a life. It's free, open to the public, and simple, and you can help save someone's life. And attention, new moms, expecting moms, and families. This event is for you. The Porter County Health Department invites you to our first ever community baby shower right here in Valparaiso on Friday, October 17th from 11 a.m. to 3 p.m. at the Porter County Community Foundation Building. Come enjoy a welcoming day filled with resources, helpful information, giveaways, and connections to local programs designed to help you and your baby. Whether you're preparing for your little one's arrival or already caring for your newborn, this is a wonderful chance for you to learn, share, and celebrate parenthood. Mark your calendars and bring a friend because you won't want to miss out on this. For more details, you can visit the Porter County Health Department website or just visit us on our socials. Together, we're building healthier beginnings for every baby in our community. And we hope that you learned something today from our conversation. Remember, a healthy community starts with each and every one of us. For more information on our upcoming events and programs and initiatives that we discussed today and much more, please follow us on our website. You can find us at the Porter County government website, which is www.portercountyIN.gov, or you can go straight to our health department website, www.in.gov/localhealth/Porter County, and you can find us on social media. We have Twitter, x.com/county_Porter. We're on Facebook at facebook.com/Porter County Health DEPT, or you can find us on Instagram, Porter_County HD. This is Demetrius Lewis, Communications Specialist for the Porter County Health Department, signing off. Thank you for tuning in to today's episode on WVLP 103.1 FM. And remember, this is your show for health, community connection, and overall well-being. Have a good and safe week, Porter County. Peace.